Only doctors could prescribe it, and the family of new and improved opioid painkillers evolved over the years. In the 1970s and 1980s, urged by pharmaceutical companies, doctors started giving opioids to patients with chronic pain syndrome, as well as post-surgical and dental pain, part of a cynical, industry-wide push to aggressively combat suffering. In 1996, Purdue Pharma introduced OxyContin and marketed it aggressively to doctors and patients as a miracle pill that relieves severe pain for 10 to 12 hours at a time. But the relief didn't last that long. Withdrawal began almost immediately. The medicines turned out to be terrifically habit-forming, despite Purdue's claims. By 2004, 2.4 million people were using prescription painkillers for non-medical reasons. More and more people, regular folks, became addicted to the pills their doctors or dentists prescribed for them. More and more deaths were attributed to opioids. Public health and drug control officials stepped up their efforts to treat the addiction and curb the abuse. Methadone clinics reopened, and opiate addiction programs began enrolling abusers. Prosecutors began cracking down on doctors and pharmacies running pill mills. But those much-needed reforms merely opened the door for drug cartels. And here comes Chapo, now moving heroin into the United States in bulk shipments. Heroin and prescription painkillers are similar enough that addicts who run out of one can substitute the other. Soon, heroin became the cheaper alternative. Our intelligence reports showed that Chapo had slowed down cocaine shipments to better flood the market with heroin. I talked to Cronin, who was now at SOD, and agents and intel guys from all over the country. He's brilliant, I told Cronin. He studied the market, then exploited it. Now we were facing a crisis that was destroying families. By 2011, we were seeing more heroin than ever in Chicago. Users didn't have to use a needle to shoot up, so the face of heroin addiction was different too. A lot of white, suburban, middle-class people, including older adults seeking pain relief and teens looking for a high. For me, it was like being back in St. Louis at the beginning of the methamphetamine epidemic, the overdoses, the deaths, the grieving families. We started seizing record quantities of heroin, 50 and 60 kilos. Sometimes up to 100 kilos, all of it 90% pure. That was unheard of. After one particularly big bust, an agent said to me, "What a great case. We really put a dent in it, didn't we?" "I don't think so," I told him. "This scares the crap out of me. There's just so much dope on the streets, it's unbelievable." I made sure every state representative in my 5-state DEA region understood that even though this thing was based in Chicago, it affected everyone in the country. And I knew it would only get worse when I discovered that members of one of the most ruthless gangs in Mexico were moving north. Los Zetas were the new guys in the cartel world. They kidnapped and beheaded rival gang members and posted disgusting videos on the internet. They tortured innocent civilians just to make a point. And now, the Zetas were here, in Chicago. With the heroin market exploding, they weren't about to stand on the sidelines when there was so much money to be made. They didn't trust local gangbangers to sell their dope for them. The DEA office in Laredo tipped us that the Zetas were sending some of their most trusted agents to live and work in Chicago and the Midwest. That was a disturbing development. Leaders of Mexican drug cartels rarely ventured beyond the U.S. border, but now it appeared they were sending up some key players to run their drug distribution network out of middle-class suburbs in non-border states. Putting their own guys on the ground gave them a tighter grip on the world's most lucrative narcotics market, and it maximized profits by cutting out unstable gangbanger middlemen. It was probably the most serious organized crime threat the nation had ever faced. There were more than 70 street gangs in Chicago, and between 70,000 and 125,000 people belonged to one or another of them. I likened them to 100,000 Amway salesmen, each of them looking to expand his own drug sales network. Now, here we were, adding a cell of Los Zetas to the list.